Hey everyone, hope you guys are doing well. Welcome. Today we're going to talk about ADHD and the treatment, the best treatment in the world that is available for this type of issues. So if you're wondering, like, well, I'm functional, a lot of people with ADHD are fully functional. So there's nothing that needs to be done. And there's nothing wrong with people with ADHD. It's just a little bit of a brain rewiring that I'm going to go ahead and show. Like in this picture right here, as you can see on the screen, this is a brain scan of somebody with ADHD. Now, for some people, they're functional, everything's fine, they don't need to do anything about it. But some people, it's a huge problem to be able to focus and to get things done, and it becomes an issue. And so that's why, like, if in schoolwork or even in work situations, if it's very challenging, there are some treatments to help rewire the brain where you're able to focus better. And that is some of the things that I'm going to go through in this presentation. So my name is Bjorn, and I present a treatment that I went through, and met countless of other people. And I'll show some videos of other people who have done it and had amazing results. I had really bad TBI. I'll share more about that as some pictures of that. Tran- um, Traumatic brain injury, neck injury, head injury, and they had to rewire my brain to get it functioning again. So there's nothing wrong with me physically. Well, there was a neck injury, but for people with ADHD, it's like, unless you've had like a knock to the head or something like that, which most people have not had, there's just a rewiring in the brain that has happened, and they can use electricity and small amounts of laser to restore the function of the brain. And it's not shock therapy. Okay, so don't worry, it's totally safe, and it's just a fantastic treatment that has been developed, where they're combining now these decades old brain hacks that people have been using for a long time to restore the function of their brain. And they're using that combined with this cutting edge technology that's been developed. But it's, even though it's cutting edge technology has been developed, it's been used for decades, but there are only few doctors in the world who know how to use it properly. So we're going to go through that today. So let's talk about ADHD. It's not just about attention. ADHD, attention deficit hyperactivity disorder, is a brain based regulation issue, not bad focus. Okay, it's a brain based regulation issue. It affects how the brain filters distractions, switches tasks, and controls impulses. Many people with ADHD are very smart, creative, and driven, but their brain wiring makes everyday tasks harder to do. So if you're one of them, this is for you to listen to see what you can do to be able to rewire the brain. What ADHD really feels like: people with ADHD often describe it like this: my brain never stops. It's like a browser with 50 tabs that are open. And I forget what I was doing while I was doing it. I want to focus, but my brain won't cooperate. Simple tasks feel overwhelming, and my motivation disappears without warning. I feel shame for struggling with things that look easy to others. That's the toughest one. You feel like, yeah, anyways, that feeling of shame is just like brutal. So if that's something you're struggling with, well, this is a treatment that can help you rewire the brain, and this won't be an issue anymore. It's not laziness; it's a regulation issue in the brain's executive function network. So I'm telling you, it's just a little bit of a rewiring brain in the brain's executive function that can be done. But you want to, and all these like this is not neurofeedback. Neurofeedback works for a few people. Neurofeedback is, if you're in a certain range, it can work for maybe for ADHD as well, but it's very difficult to get the brain to make the internal changes. But with transcranial direct current stimulation, tDCS, and the methods I'm going to show in this presentation, that you nudge the brain with small amounts of electricity, small amounts of current that go through the brain for 10 minutes, and it makes a change for you. So you don't have to do it yourself, and it's just so much easier. All right, so brain that can be trained. ADHD symptoms come from underactive or uncoordinated brain regions, especially in the prefrontal cortex. Medications help some, but they don't fix the root issue. So when you flood the brain with medications, let's say you have one area, like say the prefrontal cortex is the area, let's just pretend that's the area. But if you flood the entire brain with medications, with chemicals, it's going to affect every single area of your brain. And now you can have issues in these areas because you're altering them as well. So that's why medication often creates more issues than when people started. Okay, so brain rewiring tools like tDCS, neurofeedback, and cognitive training can strengthen focus, calm the mind, and improve self-control over time. Now, again, I'm not talking about neurofeedback. We're doing something totally different that is way more advanced than neurofeedback. Okay, so I'm going to just show this because this is amazing. Some stories of some people that went through this treatment and had just incredible results. Same thing as with me. And so I want you to be encouraged to just, there's one boy there who has ADHD, diagnosed with ADHD, and you can see the results from that too. So let me just play this, and then I'll talk a little bit over it. So this is a girl, JK visited IFN after suffering from traumatic brain injury after car crash. You can see the eyes can't focus. It's a brain thing. It's a brain rewiring thing. So they started working with her, and after 6 weeks, she was back to normal, living a normal life. You can see her eyes are not able to focus, and a big smile on her face. Amazing. Next one is Madison. She's 4 years old, got 100 seizures a day. I mean, it's just really tough. But after 1 week of treatment, okay, 1 week after do QEEG scan to get the brain map, but her seizure rate dropped by 90%. I mean, this is remarkable results just after a week. And then this is RH, age 12, wasn't able to walk. His doctor said that he was just trying to get attention, but he had a mild concussion and he got worse and worse. And now wasn't able to walk without assistance. Told he was simply attention seeking. This is brutal. So after 6 months of care, he's walking by himself. Amazing. After 9 months of care with IFN, yeah, he's jogging back to normal. Just living a normal teenage life. It's amazing. It's amazing what it can do. A little bit of brain rewiring. And this is Sam. He suffered a severe neck injury while on the beach, left him quadriplegic, very, very serious. He was told he has less than one chance of regaining any movement, but he had some connection in his neck. So they restore the function of their neck and the head. And then after 12 months of treatment with IFN, you can see he's walking still aided, but at least he's walking. Now he's dancing his way to recovery. There you go. Now he's walking unaided. And of course, he's improving. But this is amazing. This is a miracle. This is Ben, problem child turned award winner. He was diagnosed with ADHD and dyslexia. You can see the eyes. So IFN went ahead and saw that it was not particularly ADHD, it's just a broad term, but it was sensory confusion involved with his eyes. This was his challenge, not ADHD. So after 12 weeks of treatment, IFN is now winning awards at school. He no longer struggled with it, and he's back to living a normal life. So I'm telling you, there's so many people who have had these wonderful experiences by having their brain rewired, and it's non-invasive. You're not opening up the brain, putting a chip in there. You're not doing all this crazy stuff. You're just combining cutting-edge technologies to rewire the brain, combined with decades-old therapies. I'll show you how that works. Okay, so you can find all this information on my website, bjornbrain.com. If you forget everything I'm talking about, don't worry about it. Just go to my website, have all the information there. I'm not a doctor, so everything I'm presenting is from my personal experience. And so remember to talk to your doctor about it. So the videos that I just showed you are from IFN, Institute of Functional Neuroscience, and Dr. Randy Beck. And home treatment is available over video call. That's why I keep telling people about it, is because you can be treated at home. We spent $350,000 traveling the world trying to find the best doctors. One, they couldn't help me, and two, we just spent a fortune. We gladly took our money, but now you know how much it costs to live 3 months in California in a hotel. It's expensive. We had to do that. It was in Germany, Canada, all over the place, spending so much money. So, anyways, now you can be treated at home and over video call. Use my promo code Bjorn. It helps me out. You get a discount as well. I'm telling you, it's just amazing the stuff that you can do now. And that's why I'm so excited that Dr. Randy Beck has developed this, where you can be treated for anywhere in the world. So it's not like you have to go to Australia, where he's based in, for 6 months, because nobody can afford that. Like, that would be crazy to be allowed to do that. So anyways, this is the treatment of the videos I showed you are from here then. This is what I always look like: really bad-handed, head injury, neck injury, blindfolded, light sensitivity, sound sensitivity. But as with ADHD, it's a brain rewiring issue. I had some other issues too, so mine was a little more severe, getting me going, because I have a neck component to it as well. But anyways, I was in pretty bad shape. But anyways, all these people right here, or all these issues, these symptoms that people have, These are brain-related issues. So you can restore the function of the brain with this type of treatment, and all these like epileptic seizures, even long COVID, stroke recovery, brain, all these different things. Brain, you just rewire the brain, and then the symptoms then usually go away. Like showed you in the videos, like it is possible. They're seeing people have amazing recoveries from these, and there's other case studies too, where like people have had chronic pain, all these different really, really difficult illnesses that have really messed them up, and they've recovered by going through this treatment. All right, another thing I want to just highlight is like, for example, I had a lot of stomach issues, and the doctor said that they gave me antacids, and they said, well, you just need to take this for the rest of your life, whatever. And I was like, well, it's got to be something else. And I was in really bad shape, so bloaty. Oh, it was awful. And then we found a doctor who said that my vagus nerve was being pressed because the C1 was totally out of whack. So vagus nerve is one of the cranial nerves, and you can see all the different things like how it affects the vagus nerve affects heart rate, digestion, breathing, voice, inflammatory response, all these different things your brain or the vagus nerve affects. And because of that, you can have so if you go to doctor and you just treat the stomach, well, that's not the root issue. The root issue was the vagus nerve in the neck. So if you don't treat the neck, you're going to be, you're never going to deal with the root issue. So that's why I like going to the brain and dealing with the issues there is so much more effective than just dealing with the symptoms. So like for example, if my shoulder is like this, and go like that for a long time, my brain will think this is normal treatment, normal position, but my shoulder's supposed to be down like that. So you can do rewiring techniques yourself to teach your brain this is normal now. So somebody with ADHD, they've been in that state for a very long time. So the brain thinks that that is the normal way of processing information, but it's not the normal way. And that's why you want to go back and you want to rewire the brain back to normal. And only a few doctors know how to do it, but Dr. Beck is the best in the world at it. And I'll show you the different techniques that he uses. Okay, so Lyme disease is a bacterial coma. I have that as well. If you're curious about that, you can read more about it or ask me a question about it, but this not so much for ADHD. So these are all different things I've tried. I've tried everything, okay, every therapy out there. And I want to highlight that traditional neurofeedback is very different than what we're doing here, okay? We're doing the same scan to get the same brain map, but the treatment is very, very different. So I've tried everything, and I finally tried tDCS, and just results have been amazing. You can see no more sunglasses. I can go outside. It's just amazing. So some of the techniques that Dr. Beck used were developed at the Carrick Institute. Now they don't take patients anymore, but he worked there. Dr. Beck worked there for 10 years. And you see in this one, you see the mirror. So the boy had a head injury, so he wasn't able to lift his left arm. So they put a mirror there covering his left arm. Then he lifted his right arm up, and then in the mirror, his brain thinks he's lifting his left arm. Okay? So they use these like weird brain hacks to get the brain going, thinking that it's lifting the left arm to establish that connection in the brain. So Dr. Beck takes these, and then he got into Dr. Beck left because he wanted to get into tDCS, transcranial direct current stimulation, and QEEG brain maps, and do a combination of that. And that's that combo that is so effective. There's countless other places you can go to and get treated, but the combination you get with Dr. Beck is what is key of the best therapies combined, and very few people, I don't know of anyone else in the world who does this. So this is a QEEG brain map. You put these sensors on your head and they scan your head, and then you get this brain map, and it's different colors. And I can't read it very well, but for example, somebody with ADHD, they're very specific markers that say, okay, this person most likely has ADHD. And the way you can see it, I have another picture I'll show you if I can find it. Yeah, this is somebody with ADHD. So high beta is blue. These are blue. So from what I understand, and I'm not a doctor, I'm not trained to read these, but if you're high blue and high beta is all blue, then there's a high chance, very obvious, that you most likely have ADHD. So that's how they can interpret it. So they look at the different colors and say, okay, you want to be green, okay? But not everyone is green all everywhere. So that's just the way it is. But you want to, so you see there's blue is too slow, red is too fast, and you want to balance these out or you have more green. So they'll go in, Dr. Beck will go in, and he's the best at tailoring that treatment plan to break up all that blue, for example, or break up all that red to get your brain functioning the way it's supposed to. Because you're not supposed to be all blue like that. Okay, let me show you. Let's go back. Okay, so that's how the brain might work. And now you do this treatment. You do this at a neurofeedback center. They'll find a local one near you because you can't do this at home. So you get a scan, and then they send that scan, the results to Dr. Beck, and then he does a video call with you to talk about how the results. So again, this is you can do all this over video call. The treatment is done over video call, 18 sessions, and then you do another scan, and you see the results. You're like, oh wow, amazing! You see the change in the brain map, and you start feeling better, and you're like, wow, this is incredible. So this is Dr. Beck. He combines, like I said earlier, tDCS with multiple therapies. Now, neuroplasticity um, is amazing. Like it's the brain's incredible ability to reorganize itself by forming new neural connections as it changes in its response to stimuli. Its ability to adapt to the environment. Basically, it's just the brain can change. Okay, it can rewire itself. It's not hardwired; it's software. So it's a software issue, not a hardware issue. So as the brain, and that's a great thing because I mean, if you're hardwired, it would all be like, oh man, how do you change it? Change it back, but it can change, and that's what just it's plastic. You can bend it. It's not hardwired. So again, Dr. Beck combines these multiple therapies, and that's why he's been so successful. Where all the hardest cases in the entire world go to Dr. Beck because everyone knows him as being the best at this. He's the guy that can help people who nobody else can help, and he's always been known as that guy. And that's why yeah, it's amazing. All right, so tDCS, what in the world is it? Well, it's an emerging neuromodulation technique that provides a safe, low cost, and non invasive means of modulating the brain. It's just a little box with a battery in it that sends a small amount of current into the head and out the other side. So you see the little pads on the head. That's all it is. 10 minutes. You can buy these on Amazon yourself. This is nothing like that Dr. Beck has developed himself. This is used. I'm going to show how it's used. The military use it to rewire the brain or to train the brain, the sharpshooters, to be better at shooting. So this is a how DARPA hacked the science writer's brain and turned her into a sharpshooter. So with the device on her head, tDCS delivering electrical currents, AD went from a frustrated shooter to a skilled sniper. So it just shows that when you put that on your head and you're focusing on something, you get it. You get a lot better at it. Let's just say it as that. Like instead of taking, you could probably get the same results, but it would take a lot longer. But with using a little bit of tDCS, the results are just way faster. So it's been used for decades. It's not like this is something brand new. So don't worry about that. That it's like, oh, this is something that Dr. Beck just developed in his garage or whatever. Like that. That's not the case. This is something that he's just taking what's out there and combining it and using it for people with ADHD or people with TBI like I had and that kind of stuff. All right, so this is what the device looks like. You put it on your head and you all do all this at home. Okay, you do all this at home, but it's also supervised. So the clinicians will monitor everything you do and they'll tell you exactly where to put it. They'll look at it to make sure it's sitting correctly on there and whatnot. So you can also use it on the spine, like I showed you the guy who was paraplegic. He had or quadriplegic. They had to restore the function of his brain or his neck first, and then they could do the brain. And they send electricity up and down the spine. So they did that with me too because I had a neck injury. But with people with ADHD, unless you've had a neck injury, then there's no need to do that. So again, this is the ADHD brain map. So it's very, very clear markers. So okay, yeah, this person most likely has ADHD. And what they do, they have hundreds of thousands of scans that they've done, hundreds of thousands, and they combine your scan to those people. So and they say, okay, these people do not have ADHD, but you have ADHD. Okay, how can we tweak your brain to become more like the brain of those who do not have ADHD? And that's all they do. And then the more green you get in there, they break up those little different blue, the blue that's covered on these functional disconnects. Then you see what happened with the symptoms. Like that's all you can do. All you can do is to tweak the brain, nudge your brain with small amounts of electricity to bring it back to a level that is more similar to people who don't have ADHD. That's all he's doing. Okay. All right. So again, this is a Dr. Beck. You can call them. The way it works, you just call them, set up a call with a clinician, and then they will set up a brain scan at a clinician's office, neurofeedback most likely because they're everywhere. And then you can go there, get a scan, and then the results sent to Dr. Beck. He looks over them. You start the treatment. You do 18 sessions, and after 18 sessions, you do another scan, And then after 8 sessions, you do another scan. You keep doing it. You see the changes, and it's really amazing. You can use promo code Bjorn to get a discount on your first treatment. And I'm telling you, if you're looking for cutting edge technology combined with old school brain hacks, this is the best. Okay, I've been everywhere for treating for the brain. If you're gonna go be treated for the brain, you want to go to the best. And Dr. Beck is considered the best. He writes the manual for this kind of stuff, and he just got into it early. Early. That's why he's so good at it, because he's been doing it the longest. And it's amazing. It's really, you saw the stories of people. You can go to my website as well, and I have lots of information there. Let me see if I can pull that up, and then you can see what I have there. So this is my website, and you can see the case studies what I have here. Lots of case studies, lots of articles you can read. ADHD should be right here. There's an article about that. That's a case study. Let's go ahead and look at that. I think the case study is right here. Yeah, ADHD case study. So you can read about that. After approximately 6 months of treatment, the patient's QEEG has improved significantly, although not completely normalized as yet. Loretta analysis shows a decrease in the size of the dysfunction area as well as decrease in severity or degree of dysfunction. Symptomatically, he is much more confident and is now hesitant to strike up a conversation. He's happier at school and feels like he belongs more. His overall performance at school has improved drastically with increased focus, attention span, and memory. He's also sleeping better and experiencing better energy levels throughout the day. He is demonstrating excellence in areas which were previously his weak points, and he's generally much improved. I'm telling you, this case study. Now, I didn't read, initial findings, but let's see. When he came in, he had decreased concentration, poor attention and memory. At the onset of puberty, he began regress at school, particularly in areas of literacy, vocalizing, and comprehension. His attention span worsened, and he complained of low stamina levels despite active and had difficulty getting to sleep. Anyway, so he had some issues. And this is just after 6 months of treatment. Something I've gone for longer because mine were serious, but it depends. Every brain is different. Every brain changes differently too. But you got to do it slowly because you want the brain to stay that way. You don't want it to. You can make changes faster for the brain, but sometimes it might backfire. That's why you need to have somebody like Dr. Beck, who's done this before, who's an expert at it. And I'm telling you, he is the best in the world when it comes to this kind of stuff. So that's Dr. Beck right there. You can read more about him on the website as well. I have all the information. I have FAQs here as well. You can take a look at my contact information. Everything is here. I've just tried to make it as easy as possible with the most information, so people can just you read more of my story if you want to, more videos. This is for you. Anyways, yeah, if you know anybody with ADHD, let them know about Dr. Beck. He is the best. And I use my promo code. It helps me out as well. Promo code Bjorn, BJORN. You get a discount. And all he does is do a brain scan, and he tweaks your brain to be more like people who don't have ADHD. And then you see what the symptoms are, or how the symptoms go away. It's amazing. If you have any questions, let me know. Yeah, it's a fantastic tool using electricity, because if you do neurofeedback, the changes can happen, but it's just so slow, and trying to get that internal change, like the pressure on the person to make it's very, very difficult. But when you use that electricity just to nudge it and then create those new neural pathways, it's so much faster, so much more effective than anything else. Okay, cool. All right, guys, thank you for listening. Take care. If you have any questions, send me an email or a message on any of the social media platforms. It's all on my website. Okay, take care. Bye-bye.